My name's Eddie Moorcroft. I've had support from the social services because I have a learning disability, and they've supported me to live independently and to stay healthy and safe. That's part of the way I live. Being part of co-production is meeting new people who have a different way of thinking to you maybe, and understanding their thoughts and their feelings. I've been involved in training staff. I've been involved with interviewing for senior staff at Notts County Council to make sure that the people who we hire actually do understand what we need and what we want. It means I'm listened to. It means I can make a difference. Because I wanted to make change. A lot of things, I didn't understand a lot of things. I didn't understand the way things were working. And I wanted to have more control of my life. And other people were controlling it by telling me what I can and can't do. And I was like, if I understood more, I could take that control. It makes you think, yes, I can do it. And then you start to think, how far can I push this? What's next? Okay, I've done that, but where do I go to next?
Okay. Welcome, members, to the committee, Adult Social Care Committee of the 24th of January, and all members of the public who may be joining us online. I'm Councillor Elliott, the chairman, and I'd just like to remind members that have we got any officers joining us remotely? No. So everyone's here. The meeting is being broadcast live, so they need to make sure that use of microphones and please, no, you don't need to the camera. Please use your microphones when speaking or asking questions. Okay, let's go to agenda item 1, minutes of the last meeting of the Adult Social Care and Public Health Committee held on the 13th of December 2021. Everyone happy with those minutes? Show of hands. Okay. Agenda item 2, to note the change in the membership with the replacement Councillor Nigel Turner with Councillor Matt Barney. This is just for noting, so can I just ask? It's noted. Thank you. Agenda item 3, apologies for absence.
No apologies received. We have every member of the committee here. Thank you.
Swimming, aren't we, today? Getting through these. Yeah, okay. Agenda item 4, declarations of interest by members and officers. So, do any members or officers present have any disclosable pecuniary interests to declare? None. Do any members or officers present have any private interests, either pecuniary or non-pecuniary, to declare? None. Okay. Let's move on to agenda item 5. It's in your bundle, and it's the public health outcomes in Nottinghamshire. The report provides an update on Nottinghamshire's health and well-being using the public health outcomes framework. There are over 200 indicators which compare various aspects of health and well-being in Nottinghamshire to England and also the East Midlands region. The majority of indicators show Nottinghamshire is similar to or better than England. Notable pieces of work such as the suicide prevention, domestic abuse, and the childhood obesity Trailblazer programme have helped. However, there are currently 34 indicators where Nottinghamshire is worse than England, and for these an action plan is included as an appendix. There are a number of county council and wider partner plans and strategies which can contribute to improving these indicators. I move the recommendations on page 5 to 6 of the report and call for a seconder.
Yeah, pleased to second and reserve the right to speak.
Thank you very much, Councillor Barney. I'll hand over to the Director of Public Health, Jonathan. Okay, thank you.
Good morning, councillors. I'm really pleased that committee has asked for this report because at a difficult point in a challenging winter, this is actually something that draws our attention back to some of the things that we wish to get back to. Not to get back to business as usual, but I think probably back to something better than business as usual, because although the report shows that overall Nottinghamshire compares favourably with England average, there are of course still some areas where we've got more work to do and where we don't compare favourably with England average. And I might draw your attention to some of those things shortly. The local authority, as you'll recall, has a statutory duty to improve the health and well-being of our residents. Pre-pandemic, on a roughly annual basis, I would have brought a report like this to provide committee a view of what kind of trajectory we were on as a population, as a county, in terms of improving health and well-being, and as an opportunity to identify some of the areas that might require particular attention and improvement. So as part of fully re-engaging with our business as usual work, I want to give you visibility of where Nottinghamshire stands at the moment. The public health outcomes framework is something which is set up and provided on a national basis, and it enables us to make comparisons between Nottinghamshire County and England average. And it does that, as you've gathered, across a very wide number of indicators. And those indicators are chosen with two things in mind. First of all, what is important that we're doing right across the whole system to improve healthy life expectancy and to reduce inequalities? That's the first thing. And then the second thing is a bit more pragmatic. It's what realistically and practically speaking, what can be collected right across the country so that we can benchmark and compare different areas. So the outcomes framework covers a number of different areas that you'll recognise as being really important. Some of them relate very much to things that you might refer to as wider determinants, so the things that influence the conditions in which people are born, grow, live, work and age. Other things much more to do with health improvements, health protection, which has received so much focus, or indeed there's also a clutch of indicators that refer more to some how we're doing in terms of the delivery of our health services in Nottinghamshire. Because although all those other things I've mentioned are perhaps of primary importance, we don't want to lose sight of those. So let me, if I may, draw your attention to one or two other things before I talk you through the information that is shared in a little more detail. It's important to note that much of the information I'll be sharing will describe Nottinghamshire County at an overall level. And as I've mentioned already, at an overall level, we perform similarly to or better than England average. What we need to make mention of and to be very clear about is that within Nottinghamshire County, as you all know, there's an enormous amount of variation as well. So we need to keep our eye on, well, how does Nottinghamshire look in terms of its inequalities? And that's something which needs teasing out beyond this data. I will, if I may, just turn your attention to Appendix 1. So this starts on page 15 of 132. I need to preface this by saying I must apologise that some of the writing in here is very small. You'll need glasses or magnifying glass to get at some of it. And I want to take the opportunity just to describe to you what you find in the different columns of information so that we can orientate ourselves to it. So on page 15, my colleagues have provided an example that we can follow through ourselves. So in the middle of page 15, you'll see an indicator there, which is marked up as B01B, children in absolute low income families. So that is the indicator. The next column over tells us, is it looking at males or females or persons in general? Next one over, is it focusing on a particular age group? Then the next two are important as you look in through the rest of the appendices. This next column tells us, how is Nottinghamshire County comparing to England average? Is it significantly better or worse or similar to? The next one over is something which Public Health England, or now the UK Health Security Agency as they're called, provide us to tell us about the trend. Do we have sufficient data points for a statistician to be able to recognise a trend at all? And in some cases we do not. And a dash means that a trend cannot be calculated or is not appropriate. Or is it improving or worsening? I'll just cover off the next couple of columns as well. It's at some points I find it easy to get lost myself with an indicator. Is an indicator good if it's low, or is it good if it's high? So L for low, H for high, to tell us which way we would like that indicator to be moving. And then finally, the latest time period for which nationally we have collected all of this data. And you will see, as you skim through the appendices, some of the indicators have data right up to 2020, 2021, so for very recent time period. Others, the most recent data we have nationally relates to 2018-19. So in Nottinghamshire, we are making use of the most current data that is available, but we have to acknowledge that not all of it is current. An important thing to note there then is that in many cases, the indicators do not account for the experience and the impact that we will have seen as a result of the pandemic over the last year or two. I think that's all I wish to say by way of introduction, Chair. Back to you.
Thank you, Jonathan. That's great. I see we've got some officers joined us online now. They joined after the meeting started, but I did ask if you are online, could you just have your cameras on when speaking, please? Thank you.
Apologies. I'm sorry I was a bit late.
No, it's fine. Thank you, Joe.
I do look a bit like Big Brother, don't I?
Okay.
Down.
Thank you for that, Jonathan. Okay, I'll ask any committee members wish to speak. We've got quite a few. So I'll start with Councillor Barney.
Thank you, Chairman. Can I just begin by saying it's a real pleasure to have been included in your committee, and I look forward to being part of this committee. I've arrived 6 months late, But what a great report to start and kick things off with. And there's some overlap with this, with the work that we've been looking at on my previous committee with the Health Scrutiny Group, and members of the Health Scrutiny Group will know how much we've been looking at early years life, particularly maternity services, NUH. And as such, because I think probably because of that background context, I was interested to look particularly at the aspects of this report that relate to early years, particularly those very early years at birth, and the differences they make to people's life chances and outcomes over the rest of their lives. I found this actually really, really fascinating. So everybody, I think, is probably aware on this committee of the importance of the first 1,001 days of a child's life and the impact that can have. There's been lots of studies done on that, lots of talk in very esteemed circles about the 1,001 days impact. And as such, there were two elements that I would like to pick up on, if that's okay, Jonathan. The first being breastfeeding prevalence. I see a note that as an authority, it states here that we're doing worse in Nottinghamshire than the rest of the country, and that's in the first 6 to 8 weeks. And I found that a particular concern, so just wanted to drill down into that a little bit. And the second area, which I was really intrigued about, it states that we're doing better on new birth visits completed within the first 14 days, which I, of course, welcome. But again, was quite surprised by that, particularly the difficulties we've had. I note that this data doesn't relate to COVID times, although the date time frame around this is 2021. So this is on page 17. Is what I referred to, CO7, proportion of new births completed within 14 days. I just wondered if you could add any more data on that and could provide us with more information. Thank you.
Thank you.
Yeah, certainly.
Thanks, Matt. And great to have you on the committee. Welcome. Good couple of questions there. I'm going to hand over to Jonathan to pick those up for you straight away. Okay.
Thank you, Chair, and thank you, Councillor Barney, and thank you for drawing out straight away the importance of the whole life course in terms of the healthy life expectancy of people in Nottinghamshire, including their experience right at the very start of life. Within Nottinghamshire, we have a best start strategy, and that picks up a focus both on breastfeeding in particular, which I think was the first part of your question. So it is one of about 20 indicators out of a full set of about 200, just a little over 200, where at the moment we can see that we, compared to England average, we are worse than England average. You can see that there's no overall trend that can be called in relation to that data at the moment. There are insufficient data points, although over on the right-hand side, from a non-statistician's perspective, you can see that the data's moved around somewhat, but is improving over time. Breastfeeding prevalence is something which is influenced by a number of different factors. In terms of our services to support this, our maternity services, those commissioned by the CCG, provided through our hospital trusts, have a key role to play there, particularly in terms of breastfeeding being initiated at the time of birth. But then later on, our Healthy Families programme have a role to play in supporting women to continue with breastfeeding. And that perhaps segues into, I think, the second thing that you were asking about. You drew our attention on page 17 to the proportion, I think it's a C07, proportion of new birth visits completed within 14 days. And you asked whether we have more information about that. Yeah, we perform better than England average on that indicator as things stand. And perhaps the other things that I would just draw out on this is that in common with many health services over the pandemic period, and in response to national guidance that local authorities have been given, some changes had to be made to the Healthy Families programme that delivers these new birth visits. But we were careful to make sure that that this element of the service continued. This was identified as being essential and important, and those new birth visits continued. And out of, and I have the data here, that out of something over 7,000 new births in Nottinghamshire. There were 7,282 that were completed in Nottinghamshire in that year, and that represented 98.5% of new birth visits completed within the 14 days. And I know from what colleagues have briefed me on, because we did a little bit of follow-up work on this recently, that all of those, except about 100, involved face-to-face visits as well, that being a very important element. In a small number of cases, and many of those being in the first quarter, in the early stages of the pandemic, they weren't completed face-to-face. And most of those, when we went back to audit those, were not completed face-to-face because the mothers concerned did not want a face-to-face visit for reasons one can understand in a pandemic. They were satisfied at that stage that they didn't need it. Now, of course, further work was done around that because safeguarding has remained a primary concern and consideration. And so where families were identified to be vulnerable or high risk in some way, there were separate arrangements in place to follow up with those families in any case. I hope I've fleshed out a little bit how we compare to England average in not just in relative terms, but also that 98.5% of these are done within the 14 days. Thank you.
Thank you, Jonathan, for that.
Chair, could I do just a point of clarification?
Of course.
Just that you get the impression that a new birth visit might be the first contact people have with the baby, and that if it doesn't happen somehow that the baby has never been seen. Can we just clarify that every single baby is checked over before it's discharged from the hospital? Every baby has a hearing test. Every baby's had a check for congenital abnormalities and fatal heart-related conditions before it gets home. So although these are important visits, they're often to pick up on social aspects, like you've said. But the idea that any baby's coming home and waiting on the health visitor, the staff, to examine it when it gets home, in case anybody's listening in, is not the case. They've all actually been seen. And if one baby comes home without being seen, I get an immediate call to actually go and see and examine that child. So all children are examined after birth, regardless of whether they get this visit, just to clarify that.
Thank you, John. Michelle?
Chair, given the current situation at NUH and when I had a baby, I can categorically say that all of what you said apparently happened doesn't always happen. And I think we need to be really careful about saying that it always happens, because it doesn't. And I've got my own personal experience around that, and I've probably got about 50 women that I deal with where that doesn't always happen. So I just as a word of warning, really, it doesn't always happen. I know it's supposed to happen, but it does not. It certainly didn't happen at the beginning of the pandemic when I had my baby. So it doesn't always happen. And I can categorically say that. It doesn't always happen, especially around the hearing as well. What happened with hearing tests with babies at the beginning of that pandemic was nothing short of disgraceful.
I'm going to hand back to. Okay, can I hand back to Jonathan?
Thank you. So just to underline then that these are important tests, and there are important considerations related to our maternity services, which, as I understand, are being followed up through Health Scrutiny Committee. In regard to the Healthy Families programme, members can be assured about the performance of the service which we commission from the local authority in this regard.
Thank you. Councillor Martin?
Sorry, Councillor, can you use your microphone? Thank you.
Sorry. Yeah, it's a great report, Jonathan. It highlights all the good and bad, although the data is a bit old in some of the areas, and I think that's a problem. It's a national problem, because keeping up to speed with it, especially after the pandemic, is quite important, really. So I refer to page 15B02A, school readiness of children applying for free school meals. although I welcome the fact that we're below the national average, it's still an area of concern for me, especially from Ashfield, the areas of Ashfield and Mansfield particularly. So I don't think these figures tell the whole story, especially after the pandemic. Take for instance, free school meal claimants. There's been a significant rise in claimants since the start of COVID, and this is more acute in Ashfield, where 27.1% of pupils claimed free school meals, and Mansfield it was 26%. This is compared to Rushcliffe, where it's only 10%. Child hunger is a massive issue in the areas with higher deprivation, and it suggests, you know, obviously child hunger has an impact on educational attainment. In parts of Ashfield, impoverished children returning to school after the weekend, still feeling hungry from the weekend. So I'm just wondering if there's anything we can do where we've got a geographical demographic map, if there's anything we can do about that, because obviously kids are coming back on Monday morning saying they're hungry, and I've had this from teaching assistants across the district, you know. So the other thing is as well, I was looking at page 21, another issue that's been going on for some time, especially in Ashfield. In fact, it was higher in Ashfield than it was anywhere across the county, is CO3C, smoking in early pregnancy. We must do something to tackle that issue, because that's a real serious issue, especially amongst teenage mothers across Ashfield and Mansfield. I know we've got the highest statistics for that. And the other one, I can't think which one it was now. I've lost it. It was on there anyway, but anyway, that was my other concern, and the fact that violence is getting higher. Violence offences per 100,000 on page 22. So obviously that's a reflection of the pandemic, because it's just it's something that we've got to keep our eye on, isn't it? Really, is what I'm saying. So obviously the data needs updating as much as possible, because that helps you do your job, doesn't it? Really, you know, that helps you monitor the areas where we've got problems. So that's all I've got to say, Chair. Thanks.
Thank you. Shall I take some more questions and pick them all up? Yeah, Councillor Kerry.
Yes, thank you, Chairman. And I want to follow on from Councillor Martin. A bit personal here. I was born 4 weeks early a long time ago, when medicine was not quite as advanced as it is today. 3 pounds 3 ounces, and I'm very lucky, I believe, to be alive today. So I appreciate every day of my life. I believe the cause of that was smoking, and smoking during pregnancy. My mum and dad used to smoke 40 Park Drive or more per day, and I don't, if anybody remembers Park Drive, they were an untipped cigarette. They were lethal. We didn't know at the time the problems that smoking created. In fact, in my early childhood, I used to go down to the local shop and buy them for them. So I feel guilty about that. My dad died at 47 through cancer caused by said wonderful things, and my mum spent a long time in her later years on an oxygen machine because she had no lungs left. So smoking is a terrible thing, and whatever we can do, in my opinion, to improve it is a very positive thing. And I would just like to ask if there's any information that Mr. Griffin can give us about the impact of smoking, both during pregnancy and after, and its impact in mortality and loss of quality of life. Thank you.
Pick those up, Jonathan. Thank you.
Certainly, thank you, councillors. Councillor Martin, yeah, thank you. There is always going to be some lag in this data, but you're quite right. Thank you for underlining the importance of ensuring that nationally we make sure that we're working with the most up-to-date information. And I think the wider points that you were making underline, again, the inequalities which exist within the county and some of the issues of deprivation that you underline, particularly in Ashfield, that you wish to highlight. And I think those are important to draw out because actually those are what is shaping the experience of the population in terms of our healthy life expectancy. We find that although there are some really important things that we can and must do in terms of providing good healthcare services, in overall terms, it's the conditions in which we are born into, that we grow up in, that we live in, that we work in, that we age in, which is shaping the experience. And so that's why we must continually come back to making sure that we're creating places in Nottinghamshire which are health promoting. So you also picked out some issues regarding the food environment more specifically. And I think you talked about children coming into school hungry in the mornings. I think that probably picks up the theme which all of council were working on last week in the motion that was passed, and underlines the importance of nutrition and the food environment in terms of building supporting a healthy life expectancy right across Nottinghamshire. Alongside tobacco, good nutrition and diet is an enormously important influence over our health and well-being. So I'm really pleased that councillors agreed to put fresh energy and momentum behind that, and that in the motion that they passed, they also specifically name and have articulated the inequalities that exist around that. In terms, and you noted as well, there are indicators in here that draw more widely in terms of violence and people's experience of community safety as well. And I think that underlines again the extent to which our health and well-being is shaped by a really wide range of factors. Healthcare services and social care being one of them, but focusing on those alone not being sufficient. And Councillor Kerry, in a sense, you made a similar point in terms of what what you reported on there. In answer to your specific question, to try and answer that at a top level, what is the contribution and the impact of tobacco use in Nottinghamshire? So the international evidence indicates that up to half the difference in the healthy life expectancy that is experienced by people living in the most advantaged and the least advantaged parts of our county. So half of that difference in healthy life expectancy is made up of differences in smoking prevalence. So tobacco accounts still for a very large proportion of the inequalities that we properly focus on again, which is why tobacco control, alongside some other things, will once again remain front and centre of our joint health and wellbeing strategy, and is also very prominent in our new council plan as well. I'm hoping I've addressed the breadth of what was covered there.
Yeah, Councillor Martin, you want to come back with something?
Yes, thank you, Chair. Obviously, across Ashfield, we've recognised those issues, which is why we're making improvements to the green spaces and to leisure centres across the district, because we do understand that our district has a higher deprivation, and only by encouraging health and well-being across the district with better leisure facilities and green space improvements can we make any impact on that in the long term. The one that I missed out earlier, Chair, if you'll indulge me, is the percentage of looked after children whose well-being is a cause for concern. That's on the increase, although, and this was done in 1920, and I just wanted to highlight that I think we should keep a close eye on that for looked after children. Thank you, Chair.
2020. I can't remember 1920. Councillor Moxon, next, thank you.
Thank you, Chair. Just looking at the indicators where Nottinghamshire's worse than England. I know a lot of these have already been picked up, but the one thing I picked up was about the social isolation. So it's B18B for those following on the sheet on page 21. So this shows that we're obviously worse than the rest of England. I'm just wanting to see how that's changed since sort of coming from pre-COVID and through COVID times, and what we're going to do to address that going forward, because obviously that's an important aspect of people's mental health going forward, especially as we come out of the pandemic.
I'm wondering if I might start an answer and possibly allow Melanie to chip in on this as well. So we're currently undertaking a piece of work. In fact, I think it was mentioned at full council. We're currently scoping a piece of work to assess the impact of COVID on the health and well-being of people in Nottinghamshire. That, I think, is going to end up being quite a large piece of work. So I think we'll probably break it into chapters and phase it over the period ahead. And it may well be that loneliness and isolation is one of the things that we need to pick up in that. Because this particular indicator focuses on the experience of adult social care users, I'm just wondering, Melanie, if you're able to comment.
Yeah, so certainly there's that system piece of work where we're looking at mental health being a priority in both the health and wellbeing strategy and in the integrated care system strategy, because we recognise that mental health, I think universally people are saying that's one of the most significant risk factors recently, but being very specific about both carers, which are indicated here, and older adults, I think are the groups we're particularly concerned about. Within Sue's operational area, there's a project, a social isolation project. So we're looking at a specific experience of people, particularly somebody who's older, possibly over 75, whose main social contact is their carer, which I'm sure you can imagine is quite a lonely place to be, where you meet somebody when they're coming to help you get dressed or maybe prepare a meal, and that's the only contact that you have. So we're just looking at ways we can increase that, and some of that involves working in partnership with Inspire, because Inspire will do like a library loan service as an element of befriending. So we're looking at where we can make those links, and then through the carer work, we're just looking at this through the carers hubs. There's a piece of work looking at how we can start to improve the social contact of carers, if that's helpful.
Thank you. That's really helpful. Councillor Carr.
Particularly looking at page 41, Appendix 2, B17, that talks about fuel poverty. This is something that worries me, and I know it worries lots of other people hugely at the moment. Just to give you a bit of background, my wife, who deals with all these things, has recently changed our energy contract, and our monthly bill has gone up by 63%, and I understand that is actually quite a low figure. I know of some people who I represent whose energy bills have doubled since they renewed their energy contract, and that is a huge worry. The issue that we've got here, and I'll try to be as unpolitical as I can be, is that generally poverty is going up, and it is likely to increase significantly. I hold food bank vouchers for the Hope Centre in Beeston North, and it's gone balmy, absolutely balmy. You know, I was probably dishing out 1 or 2 a week. Last week I dished out 16 in 1 week, and it is a huge worry. And I know people that were on the breadline before all this was happening, but let's look what's happening. Energy inflation, fueled by the potential problems that we may have in Russia and the Ukraine, I accept that, and food inflation, which in a lot of instances is absolutely amazing. It's spiralling, it really is spiralling. But at the same time, those people in society who are the least well off are seeing a reduction in their income. You know, I know that the £20 universal credit was temporary, but quite frankly, that £20 is now needed to actually make up for the fact that food's gone up and energy's gone up. The main things that people at that level of society need the most. That's their main expenditure. And of course, let's not forget national insurance is soon to go up as well. And you may not realise this, but national insurance actually starts kicking in when you earn £680 a month. £680 a month, and you will pay national insurance. Yet the people who earn more than £50,000 a year paid proportionately less in national insurance than those who earn £680 a month. It is absolutely ridiculous. So we've got these two pressures, one on people's incomes and one on people's expenditure, which is bound to tip some people over the edge. And this is what is worrying me, and the direct impact that that will have on children as well. Two of the most important things to nurture children and families is warmth and food. And warmth and food is going up hugely, and at the same time, people's incomes are reducing significantly. So all I would ask is, what direct actions can this council take in conjunction with partners to help our poorest residents?
Jonathan, have you got an answer to
the
food poverty?
Well, I'll just a part of an answer to let you know some of the things which the council is doing in terms of the new council plan, of course, which is built around a public health model around inclusive and sustainable economies, which speaks very much, I think, to your point. So the council plan will in part address some of what you highlight, as will the joint health and wellbeing strategy. But I think I need to come back to the central point that you're making and the link to healthy life expectancy and life expectancy, which are the overarching indicators, which I'm very focused on and working with our health and wellbeing board partners. And of course, we do know that prior to the pandemic, life expectancy had already stalled for some groups for the first time in about 100 years, and is a good indication that the conditions in which people are being born, living, growing, working and aging in many cases are no longer improving, and for some have gone backwards.
Thank you, Jonathan. And as the county, we are working, having better communication with our districts and boroughs to tackle. They have ways of tackling and outreach into those areas. So thank you for the question anyway, Steve. It's not you yet, Paul, but you're very close. You won't get a written response, okay? We'll go to Councillor Welsh. Thank you.
Chair, I don't mind if Paul wants to go first because he's lead member. If you want to do that, right?
Just take them in the order.
All right, okay.
Okay.
Just trying to be polite. Yeah, there's a number of things. First of all, I think this report is really, really helpful. Really, really helpful. I'd be really interested to see this as a health inequalities marker with regards to Nottinghamshire. Because when we talk about worse compared to England, it'd be really interesting to see how Mansfield is, or Gedling is, or Ashfield actually is. Because I think some of the things that you've raised, Councillor Martin, with regards to experience, with regards to free school meals and the large uptake of that and school readiness, if it reflects what's happening in the rest of the country, the more deprived areas that it are, these seem to get worse. And that's not being disrespectful to those areas at all. It's just saying it'd be really interesting for us, I think, as a council and perhaps as a committee, to see how this actually pans out in Nottinghamshire and what those differences are. So that's the first thing. I wanted to just bring up a couple of things that concerning women's health. And that is with regards to cancer screening for breast cancer. These on page 17, so that's the C2 kind of section. cancer screening coverage for cervical cancer and cancer screening for bowel cancer. I've even got my glasses on as well. The reason that I'm asking about those is we do hear a lot of things in the media, don't we, about the way cancer services are panning out post-pandemic and during the pandemic. I'm just wondering, with the fact that we're not doing as much of the screening and health checks. In fact, I think the GP that came to Health Scrutiny Committee, and Councillor Barney may be able to correct me, is they're not doing those standard health checks at GPs at the moment, is what he said. How is this affecting how this is being picked up and what is going on? Because it says on breast cancer that it's worsening, and it says on cervical cancer it's worsening, and these are 2020 stats. We've had a pandemic in the midst of all that, and everyone is telling us that it's getting worse and that people are missing out on that initial screening, and people are getting. And the reason I say this as well is a bit of a personal plea with regards to this as well, because my partner has a friend where unfortunately the initial screening wasn't done as when he was asked for it when he went to the GP, and now we're in the most horrendous situation that you could possibly imagine with regards to this. So it is a plea with regards to the cancer screenings. That's my first thing. The other thing is as well, here it does say in C26B, which is why I've raised it as well, about who received an NHS health check. Again, I understand from Health Scrutiny Committee that these aren't happening at all at the moment. And if that is the case, I struggle. If we're better than the country and we're not doing it at the moment, what does that mean for the rest of the country? Or is it just we've not got that data within that? That's my first few things. New birth visits completed within 14 days. Can I get some clarity with regards to that? Because it was confirmed within Health Scrutiny Committee that that was actually not necessarily home visits, it was a phone call. Certainly when Billy was born, March the 27th, 2020, the health visitors told us they would not be visiting. So the midwife didn't visit me when I came home, and the health visitors did not visit him for his check at 14, certainly not within those 14 days, even though he was high risk. So even though he was born deaf and he had a number of health implications, I did not fit the criteria for a home visit, and was not abnormal at that time. And my understanding is that those home visits, and this is still happening now, are very often phone calls. Certainly Billy's last development check, which was across Gedling as well, and I understand it's across Nottinghamshire, that was also a phone call as well. It's only because I've seen the GP last week that Billy's actually been seen by a health professional. What I'm really concerned about, Jonathan, and I keep having to say this, if with regards to maternity, I get really frustrated that I have to keep saying these things again and again and again. And I look at people and I think, Michelle, you're saying the same thing. You're repeating yourself, because I keep coming to meetings and I hear people say, like doctors say, oh, no, they all get, it's fine. It's not fine. It wasn't fine. And women have been in a real difficult position. And I want at some point someone to acknowledge the fact that women have had a really tough time that have had babies during this pandemic. Because every time I bring it up in this county council, that is not acknowledged at all, and it needs to be acknowledged. So that's my other thing. And last but certainly not least, how are we going to feed this into the Children and Young People's Committee? And the reason I say this is, the last Children and Young People's Committee, I spoke up about school readiness and how I was worried about the impact on COVID for babies that were born in lockdown with regards to language development, their social skills, their emotional well-being. And I was particularly about those that may have gone off the radar. So I know, for example, that children that are just starting to go to nursery now where people are going back to work, a lot of their language development is not up to where it should be. It's really not up to where it should be, which actually presents a very real danger for when they start school. And when I've said this in Children and Young People's Committee, I was literally told that this wasn't the case and children were attending school and everyone was ready and everything was great. But this is, it's saying it's improving 2018-19. Since then, you've had children that haven't had the same experience with regards to education, to support, to mothers and toddlers groups, to tiny talk, to baby yoga, all of those things that women are actively encouraged to take their children, and fathers too as well, won't forget fathers, to take their children to, did not happen. And it's right they shouldn't have happened because they're in a pandemic. But how can we ignore the fact that it didn't happen and still expect our children and babies to develop exactly the same? So it's a bit of a, I know it falls here because it's public health and public health falls in adult social care and health, but it's a bit of a plea, one with regards to maternity and early years, but how do we get this information to children and young people so it impacts on what they do? And last but not least, where it says the action plan is often worded as sentences of aspiration and not exactly an action plan. So for all these things, it would be useful at some point for us to know what is actually happening on the ground with regards to this, because, you know, when you talk about breastfeeding, continue efforts to improve the prevalence of breastfeeding, focus on areas of council, that's great, but how actually are we doing that, and what are we doing? So those are my main ones. Thank you.
Thank you, Councillor. Before I hand over to Jonathan, but Paul, bet you we should go on first now, don't you? As for the early years, I'll let Jonathan pick. But I know the cancer bowel screening, they are doing that locally. I'll speak from a personal experience. My father, who just fits into that category, 73 years old, he was screened earlier on this year, and they picked up a cancer, and he's had a 5-week intensive course of chemo and radio during lockdown, where he visited the hospital every day, and now we're just waiting for the results to come back on that. But it looks very, very positive, and I think the work that the hospitals have done with him has been amazing, and my mother. So yeah, definitely the bowel screening was being picked up locally, and that's Gedling. Thank you, Jonathan.
Thank you, Chair, and thank you, Councillor, for the questions. In terms of being clear about actually what's the action associated with all of these, you're right. There's a whole range of things here that could do with being fleshed out in exactly that way. We attempted that in December 2019, I think, in the paper that we brought, and found that it was rather overwhelming. We've pared it back on this occasion, but would be pleased to bring back specific parts of this for further consideration and to provide assurance to members around that. In terms of the new birth visits, and another general point to make, because I think it cropped up several times, the data in here that you've got, there are very few indicators where it includes the pandemic period. Most of it doesn't, and that comes back to the point around in Nottinghamshire us needing to complete an assessment of what the COVID impact has been. So that's work that is planned. It's not completed yet. In fact, we're just doing the scoping at the moment of that. But we'll bring that back in due course. In terms of the new birth visits, I think it is important in terms of the work of this committee to make a distinction between what is happening in the services that are commissioned by the local NHS, including the midwifery services on the one hand, which is part of what you alluded to, and on the other hand, the performance of our Healthy Families programme on the other, which is commissioned very much by this organisation. Now, I'm aware that from the perspective of a new mum in Nottinghamshire, she won't much mind which it is that provides the service. But in terms of the focus of the response I'm going to give you, I'm focusing very much on the service that we commission. During pandemic, the new birth visit has comprised two elements. It's comprised a phone call and a face-to-face visit. The face-to-face visit has been shrunk down, it's been minimised in order to reduce the risk. And this, again, was bearing in mind national guidance that as a local authority commissioner we've been required to take on board. But we felt, it's been important to preserve that for some of the reasons that you've said. I think we've given the invitation before. If you have some more information about some specific situations, that we'd be pleased to look at those. The information that we've done on the basis of the auditing that we've got so far is that 98.5% across the whole year of those new birth visits were completed within that 14-day period. As I say, happy to look at any further evidence or information that you've got that would enable us to follow up something specifically. Regarding screening and health checks, there were two or three important things that you've observed and picked up. If we're looking at cervical screening, nationally over a period of 10 years or more, we've seen a decline in uptake of cervical screening. That is a concern in its own right and was a focus of activity by NHS England in particular prior to the pandemic, and that trend continues up until the last data points that we can provide within this report. If we're thinking about screening and health checks more generally, you're quite right that NHS health checks, very few have been done over the pandemic period in Nottinghamshire County. And in fact, again, in response to guidance that we've received, primary care, we are encouraged not to press primary care, from whom we commission NHS health checks, to be working on this at the moment, because through this winter there are other more valuable things and more pressing things that they need to do. And as we know, there's only so much resource in primary care to devote to these. Nevertheless, if we look back in time, I think Nottinghamshire County has performed relatively well on health checks, and it will need to be something that we come back to as part of our recovery plan. The focus that we'll bring to this within Nottinghamshire County, that will be through a health protection board. We've had something similar that's run in the past, and coming out of pandemic, we're wanting to strengthen the arrangements around that. One of the things that we'll be looking at is the uptake of all of the screening programs we have, including health checks, but also the things which are commissioned and delivered from NHS England by parties other than the local authority. Thank you.
Thank you, Jonathan. I've got two more speakers. I've got Councillor Henshaw first. Thank you.
Thanks, Chair, for bringing me in. I don't particularly want to prolong the meeting because a lot of what I wanted to pick up has already been touched upon. But in relation to the report, I think our side generally welcomes the report and are supportive of it. Saying that, well, there might be a few caveats. The 34 indicators where we need to improve, and I see from the report that there are plans in place to address those issues. It's been touched upon, though, when it says in the report, refer to the Nottinghamshire County Plan, County Council Plan, or to the Adult Social Care Plan. It's how that plan relates to the situation in relation to improving the indicator that we need to improve upon. So, we sort of need to sort of fine tune that a little bit. And in relation to some of the statistics, which we all acknowledge are a little bit out of date, but nevertheless they show a trend. And I think everybody in this room has picked up the point that there is a definite correlation between inequalities, poverty, and ill health. So therefore, those inequalities and that poverty needs to be addressed. So there are areas in my division, in Mansfield West, that when you look at this report, it's a wonder that there's anybody alive, because they struggle. They struggle from day to day. They struggle to get the education in relation to healthy eating. And I'm glad that at the last council meeting, as a council, we're taking nutrition and healthy eating on board, so that we were making plans to educate people and help them to improve life choices. But when you look at the statistics, are we really happy as a committee or as a council to say we're similar compared to some parts of England? There seems to be a lot of those sort of, I would say, mid-table sort of things where we're similar, we're not better than, we're not worse than, but similar. I think those similarities or those indicators that say that, I think those are some of the areas which we need to actually concentrate on as well. And then I suppose it's right that individual councillors will give anecdotal evidence in relation to their personal experiences with this, and that's not a bad thing, because then you actually get to know what's actually happening to human beings who are indicated in these sort of reports. I've got two particular questions, or let's make it three then, Jonathan. In relation to the statistics, do you think there is enough there will be enough progress to get up-to-date information, and how soon will that be? In relation to, we can't always fall back and say it's COVID. We need to have some point in the future where our statistics will be more accurate and in tune with what's actually happening. The other point I want to ask on is in relation to the item in the report, page 1218, on the gap in life expectancy. I think that's something that we ought to really concentrate on and look at. I mean, there are areas in different divisions where, as it says in the report, the more affluent areas, people will tend to have a greater life expectancy than those in the less affluent areas, and those areas where there is more poverty and inequality. So that's an important issue I think we ought to concentrate on. And the third question, it's in relation to the point in the appendices, page 29, the gap between employment rates with people with a learning disability and their ability to gain employment. Working in that sort of field, there are a lot of instances where people with a learning disability, if they're just given the chance and given an opportunity and additional training, can and should be able to hold down a job. And I think the commitment to sort of improving that statistic is welcome, but just 111 more adults with a learning disability into employment by 2025, I think that's something that we should look at and try and bring it from 2025 so it's closer. Thanks, Chair, for that.
Thank you, Councillor Henshaw. Do you want to pick those up, and then we'll go to the last two speakers?
Yep. Thank you. I can comment briefly on those. In terms of the last one around employment for people with disability, I don't know, Melanie, whether that's something you want to comment on briefly. But thank you. Just to underline, the data that we're using here is provided nationally. We have and will have more current information that we collect locally. And an example of that is the COVID impact assessment work that we'll be doing over the coming months. That will be important and will provide us some granular detail. What it won't enable us to do as readily is to make a comparison with how Nottinghamshire stands with the rest of the country. But the point that you make there is important. Just because we're doing similarly to the rest of the country is not necessarily a good thing at all. Because for some of these indicators, we see that nationally things are heading in a poor direction. In others, we see that nationally it's heading in a good direction. But we don't necessarily want to be middle of the pack. We aspire to something better than that. And importantly, we aspire to that not just for our most advantaged communities or for Nottinghamshire on average, but to pick up your point, to make sure that it's also the case for all of our communities. And I think that comes back to the importance of us focusing on the inequality, the variation and the inequalities as well. Thank you.
Thank you, Jonathan. Just conscious of the time, I know it's an important debate, but we've got two more speakers and then we'll move to the vote, okay? All right, so Councillor Doddy.
Thanks very much, Chair. I was touched by the dimension of loneliness and its importance in society. And I go round to the local shop for my newspaper every morning, and there's a lady there who stands in the aisle waiting for people to come in so she can talk to them. And she would grab me and say, "I'm so lonely, I cry every day." So in general practice, we've all got an attached social prescriber who is aware of all the clubs and events and things in the area, and we now direct anybody who we suspect would benefit from social contact directly to the social prescriber to include them in events, etc., where they want to be involved. Is a really important starting point with regards to this, and I feel like we're really just looking at public health outcome frameworks almost for the first time because of COVID, etc. And it's almost like the first day of starting a diet or something like that. We don't know where it's going to lead, but we're optimistic that we'll make some improvement over the coming 3 or 4 years. I think one of the things that I wanted to highlight was the things that we're actually doing in a positive sense. And if you look at the Childhood Obesity Trailblazer programme, I wanted to point it out that we're one of only 5 counties in the whole of England who got the funding to look for what I previously described as the holy grail of trying to tackle childhood obesity. We had pointed out that, something like 15% of kids at 5 years of age are obese, and maybe as many as 25% in the deprived areas at year 6 when they're 10 or 11 years of age. And the Childhood Obesity Trailblazing Programme has pointed out that they're making significant inroads into finding ways of giving children a healthy start. I think it was Councillor Barney mentioned the first 1,001 days of life. And obviously something key occurs during that period of time that sets in motion the whole bandwagon that leads to this nutritional emergency that we all recognised last Thursday, and the importance of the motion going forward to say that we are going to recognise it as a county and the implications it has for our children, because once we set a child on the path to ill health, you get an ill health adult and you get shortened healthy life expectancy. So I think that's something that might be worth an update on at some stage from John Wilcox with regards to the important work he's done in this area, and maybe to help us find the leader on nutrition that we agreed to back on the last meeting. It's still a case that we all trot out, the idea that people in Rushcliffe lead a life that's 7 years longer than people in Ashfield, and that the people in Ashfield are more likely to be ill earlier and be ill for 14 years longer. It would be nice at some stage to be able to change those statistics. They've been like that since I can remember. They're like sort of something like the grim fairy tales that we just learned as a child, and we continue to replicate them. They could be better, they could be worse. I don't know. My money would be on worse, personally. I think nutrition and obviously the best start in life is absolutely crucial. We did get Councillor Kerry mentioning the fact that he was born at £3 3 ounces. I suppose if you look at the fact that the average baby in the UK is £7 2 ounces, you were less than half the size of a normal baby, which is quite remarkable. So congratulations on your achievements to date. I think smoking was the key issue that you brought out there about smoking and intrauterine growth retardation. You get preeclamptic toxicity, you get spontaneous abortions, you get premature deliveries. So it's a huge thing in terms of antenatal care. And I was going to ask Jonathan, recently in the BMJ there was a lovely article on financial incentives in deprived places to improve the reduction of smoking in pregnancy, and it was shown to double it. It was a figure of something like 400 quid, 100 quid at the beginning, then throughout, depending on negative smoking tests, you got those incentives right up until the postnatal period. And although it didn't follow on as to how long that cessation of smoking continued throughout that pregnancy, the improvements in the outcome for the child, and as Councillor Barney said, the first 1,001 days postnatally, very, very important. And I think that we need to skew our efforts in the future towards all aspects that can improve the most deprived areas with regards to improving the outcomes for those populations. And I think that it's something that we ought to look at, but from a public health point of view, you may have more of a national experience as to that outcome. But certainly financial incentives can double the number of people who stop smoking in the antenatal and immediate postnatal period, and that cannot be a bad thing. So going forward, I think we've got an enormous amount of challenge ahead of us. I would particularly like the Director's opinion on how much of an advance we have now made in terms of nutrition by deciding that this county is in a nutritional emergency, that we will move to a food sustainable shire, that we will appoint somebody to lead on nutrition, and how important that will be for all these statistics going forward. Thank you.
Thank you, John. And Jonathan, do you want to?
Thank you, Councillor. So I think it's really important. Nutrition and diet plays an enormous part in healthy life expectancy and life expectancy. So I think what councillors decided last week is extremely helpful and will help propel that work forward. The childhood obesity Trailblazer work has been important for a number of reasons. It's been trying new things, and having tried those things out, we have had opportunity to evaluate, to learn, to tweak them as we go along, and we now have the opportunity, I think, to attempt those at wider scale in other areas too. But I think the other thing that it's exemplified and given us further experience of is taking deliberate efforts to set about working alongside our communities and taking time, a good length of time, to listen and to discover what's important to them and how they would see some of these initiatives working, or indeed what initiatives might be required in the first place. And I know that's something that's already Melanie is leading on in terms of co-production approach across the whole of adult social care and public health. So the way we go about things as well as what we do is going to be really important for the years ahead. Thank you.
And the financial incentives, Jonathan?
On tobacco, yeah, I note the BMJ paper. As part of our recovery plan on the tobacco agenda, we're going to be working with partners across Nottinghamshire to make sure that we've got the right things in place, whether we're talking about e-cigarettes or financial incentives to particular groups or other aspects of tobacco control. So I don't have an answer to it at the moment. Traditionally, I've been a bit sceptical about that. I know that there are other, just this last week, I think there was something in the BMJ about, I think it was financial incentives related to uptake of screening. So all of these things are worth looking at where we've got intractable issues that it's difficult to turn around, and we need to be open to new ways of doing things. And this would be one example of those new things that we should at least give proper consideration to.
Thank you, Councillor Colton.
Thank you, Chairman. Just a quick comment for committee, and I'll just draw attention to page 11 of the pack, point 14 around suicide prevention. Colleagues across the chamber hopefully will have received an email recently from Democratic Services with regards to the suicide prevention training provided by Harmless. If colleagues haven't taken up that opportunity, I would warmly welcome that you do. As Councillor Barney will testify to, since becoming a councillor in 2019, that's probably the most emotional training session that I've ever sat in. It's a key part of the Way for Suicide Prevention strategy. As virtue of the offices of the public that we hold, all councillors are deeply embedded in that, in their communities and their divisions, etc. And particularly with the real-time surveillance work, we as elected members have a key role to play in that. So I really encourage members, if you haven't, please take up that training.
Thank you for that, Scott. I echo that as well. Thank you all for your comments. Welcome those. We've had an hour discussing that. It's been really yeah, some of those comments really good, and Jonathan for your just being so informative as ever. Now,
those I would like to go on one of those sessions, but unfortunately I can't make any of the dates. Will there be repeat, or will there be?
Well, let's look at getting some more dates out there, and we'll have that conversation outside, and we'll find something that will suit your diary. Okay, Steve. Okay, we'll now move to the vote. Show of hands, all in favour? That's unanimous. Carried. Thank you. Agenda item 6. Update on the delivery of the local outbreak management plan. The report represents the updated local outbreak management plan for approval, highlighting changes in relation to the ongoing COVID-19 outbreak response. Also included is a financial update regarding the Test and Trace grant and the Contain Outbreak Management Fund, which have been key to supporting the COVID-19 response service and key functions as set out in the local outbreak management plan. The report gives an update on the COVID-19 response service, which was established in September 2021, and highlights the staffing challenges faced and resolutions put forward. I move the recommendations as set out on page 5 of the report.
I'll second that, Chairman, and reserve the right to speak.
Thank you, and I'll hand over to Jonathan again. Is he?
Thank you, Chair. So the paper that you have here recommends that we approve the update to the local outbreak management plan. You'll understand that that is subject to review on an ongoing basis, and I think it's likely that in the next few weeks we'll receive fresh prompts to review it and update it further, because the government has indicated that shortly expects to be bringing out, or I think it said in due course, it will bring out some plans for spring, summer and beyond. So we'll be revisiting this again, but it would be helpful to know that this current version has your committee's approval. Also, an update for you that you asked for earlier, middle of last year, around the establishment of the COVID response service. That is largely in place now, and I'm pleased to say that as a result of it being in place, it meant that when Nottinghamshire detected the first cases of Omicron in England at the end of November, we were well positioned to step up targeted testing, to make sure that residents remained well informed, and I'm grateful to our residents for responding so positively, coming forward for vaccinations, for tests, and for isolating in a way that has helped us through the last 8 weeks. So alongside the COVID response team, there are 3 specific recommendations there, which we'd like to put to you. It really represents tweaks to the way that we run this service. Some of those in the light of challenges that we've experienced in recruiting the necessary staff, and we think there might be some other ways that we can get to the goal that we have in mind of a well-resourced COVID response service. And then finally, there's also an update for you around the Contain Outbreak Management Fund, and an update on what's been received so far, what has been invested, and just to underline to committee that we did hear just before Christmas that we will receive flexibility. We will be allowed to use flexibility to roll over unspent, uncommitted Contain Outbreak Management funds from this financial year into next financial year. What that means is that in next financial year, we will no longer need to underwrite the costs of the COVID response team using public health reserves. Instead, we can use the Contain Outbreak Management Fund. That's very welcome, because it will give committee the opportunity in due course to consider some proposals around how else we might invest those public health reserves. We're some weeks or months away from completing that work, but we're just getting going on that now. Thank you, Chair.
Thank you, Jonathan. I've got 2 councillors already indicated to speak. 3. Councillor Carr first.
Thank you, Chair. Just very brief, because I'm aware the last item took quite a bit of time. Just really before I start, just like to thank the Public Health Department here at the county. I think they've done an absolutely fantastic job. And every time I've actually contacted anybody, the response has always been very, very timely and quick. And one of those occasions was when it suddenly became apparent that one of the wards that I represent as a borough councillor and also as a county councillor of East and North had the lowest take-up for vaccinations in the whole of Broxtowe. And as a result of that, very, very quickly, the public health team got onto the CCG and arranged for the vaccine bus to visit right in the middle of the ward. Despite that, Broxtowe still has 14,000 people who haven't received a first dose. That's over 10,000 people. 19% who haven't had the second, and 35% that haven't had the third. And I can bet you that the figures for East and North will be considerably higher than that, which is a worry. That's nothing that is not for the want of trying, put it like that, that those figures are as they are. I do have to, though, point out the problems that the CCG have had with the vaccine bus. And when Omicron variant became prevalent, they did send the vaccine bus to East and North again, and it had been booked in 3 times. Of those 3 times, it didn't visit because it broke down. And on the third occasion, it turned up 50 minutes late, and I was actually there on that occasion, and several people just went and didn't stop for their vaccine. So I think that has to be improved. If we're going to get confidence, and if people think that they're going to waste their time by going down there and it's not going to be there, then that needs to be sorted out. But what I would like to ask is that I think it's pretty inevitable that at some stage in the future that we will get new variants. If it follows a typical epidemic or pandemic, those usually, touch wood, become weaker as time goes on. But how can we ensure that the momentum to get people vaccinated carries on when all of the noises coming out of government are that what people are picking up is that the government think it's over. People think it's over. You hear people saying that, when quite clearly it hasn't. It's not over. We still have to be very, very careful, which is why we're still walking around this place with masks on, and we're all sat 2 meters apart from each other, and we've got ventilation. How can we get that message out there that if you have not had your second and third doses, or even your first dose, you really need to do it? Thank you.
Thank you, Councillor, and thank you for your words of thanks, which I will pass on to the team. The comment around the vaccine bus, of course, you're right. That's organised by our local NHS colleagues, and I do know that they are making now some alternative arrangements, which I hope will be everyone is intent on ensuring that they are more reliable than the vaccine bus. In terms of vaccine uptake, and perhaps not only uptake of COVID vaccine, but of flu and of other vaccinations, immunisations, and indeed screening programmes, and dare I say it, health and wellbeing interventions more generally. If you'll allow me a generalisation, it is those communities where there's relatively low uptake of COVID vaccine at the moment, who also have relatively low uptake in some of these other interventions as well. And that often represents the extent to which they are underserved by us. I think part of the answer then to your question needs to be not us just focusing on uptake of the COVID vaccines, but actually working with some of these communities to make sure that the way things are communicated, that access for them is provided in a way that is properly suitable, and indeed that we spend perhaps a little longer listening to what some of their concerns are that they would wish to raise with us, and attend to some of those too. And then finally, just to no, I won't even go there. Thank you. That's all.
Thank you, Councillor Martin.
Yeah, thank you, Chair. Yeah, I'd just like to reiterate what Councillor Carr said about the public health workers across the county. You've done an excellent job during COVID, as has the rest of the NHS. It's been an excellent programme. But I think as we coming out of Omicron this year, people are getting COVID weary, and I think it's been more prevalent since New Year's Eve, in my experience anyway, that the under 40s believe they're more bulletproof, and of course they're not using the track and trace anymore because they're COVID weary. They're getting apathetic with it, and the younger the people, the younger the residents are, the more disregarding they are of the system that's been put in place. I'll give you a typical example. My son went to a football match watching Matlock Town in Derby, and an anti-vaxxer went on the bus with them. Every single person on that bus caught COVID because he had COVID, and he didn't believe in it because he's an anti-vaxxer, and he went there knowing he had COVID, not knowing he had COVID, gave it to everybody. They then went home and gave it to everybody else. That's why I didn't come to the last Adult Health and Social Care meeting. And I think the despondency is exacerbated because a particular side effect is that when you've had 2 vaccines and a booster, as I'd had, and it didn't affect me at all, the younger generation are looking at me and they're going, well, it's not really that bad, is it? But it affects everybody different, and that's what they're losing sight of. So the longer we come out of it, the more we carry on with it, the more despondent the younger generations will be. We older generations will know that the vaccine has made my experience less painful than a lot of people's. In fact, that's how it is. The other thing I've got to say about the track and trace system is that a lot of the lateral flow tests, when you tried to put in on your day 6, day 7 or whatever it was, when you tried to enter your information into the NHS websites, a lot of people were saying this to me, that the website wouldn't recognise the numbers or the barcodes on their lateral flow tests. And after 3 or 4 attempts with the NHS website, they just put it down and went and had a cup of tea, which is, don't blame them. But that is one of the things. And the other thing is as well, yesterday, or was it Saturday, visiting the City Ground, they're asking people to prove vaccination COVID tests. But after you tested positive for 90 days, you're not really supposed to take one. And that was lost on the staff at City Ground yesterday. And one bloke said to me, he said, well, you've got to have a negative test. And I said, but I've had COVID, and I can't take a test for 90 days. So that regulation needs altering somehow, because it's just irrelevant, really, isn't it? So they're my points on it. I think it's something to do with the NHS track and trace system. There do need to be alterations made to it, because not only are we making the younger generations more despondent, in some areas it's not working either. I'm talking about outbreak planning for next time. Thank you, Chair.
Thank you, Councillor Martin. A lot of that is not within your remit, is it, Jonathan? But would you like to comment? Or?
Really quickly, just to note, many young people have worked really hard and have been impacted really badly by coronavirus over the last 2 years. So I just want to, I'm sure you'd agree. I shouldn't presume. You may agree that I'd want to thank them for what they have done to stick with the guidance. Yes, it is onerous. The other thing we need to say is that although for so many people, thankfully, it is a mild disease, we only have to go to our hospitals to discover that, sadly, that for some people it is not a mild disease. The complications remain extremely serious for them, with implications for their families, and of course also a knock-on as well on public health, those services in particular. Thank you.
Councillor Henshaw.
Thanks, Chair. Yeah, touching on the point in relation to vaccination. Coming to the meeting this morning, I was listening to Radio 4. They had a couple of eminent virologists and a professor that had won the Nobel Peace Prize in whatever it was, and they were saying that the situation in relation to this pandemic is not necessarily over, and we've got to encourage people to
get the vaccines wherever possible. And a lot of the people that are actually in hospital are people that are, for whatever reason, they've not had the vaccination. So, I mean, I think all of us, unless you're a young Earth creationist or something that don't believe in evolution, you've got to really say, and these two eminent people were saying that this virus could mutate again, and there's no evidence to suggest that mutation would lead to a less serious disease. The situations it could mutate the other way. So it's vitally important that we encourage people to get the vaccinations and get the boosters and do what they can to protect themselves and other people. In relation to the report, yeah, it's very good, and I think I'll echo the comments that have been made in relation to thanking our staff, because, and I've said it before, our staff during this pandemic have worked tirelessly and ceaselessly to make sure that people are looked after and protected, and you know, coming out in the best traditions of local government and local health. So I don't think any of us would disagree with that. But in specifics, looking at the report, the point on paragraph 19 in relation to, I don't know whether Jonathan or the chair wants to answer this, about rough sleepers and the effect that the COVID problems had on rough sleepers. I'd hate to think that at some point in the future, all that good work we've done with the homeless people will be just cast aside, and these people that obviously needed help but also wanted help would be just sort of pushed to one side after at some point in the future when the pandemic's ended. And I'd like some reassurances on how we're going to interact with that group of people in the future. But failing that, we'll support the recommendations, Chair. Thank you.
Thank you, Councillor. On homelessness more generally, I can assure you that at the moment in the draft Joint Health and Wellbeing Strategy, homelessness is a priority in that, partly for the reasons that you've mentioned. Of course, some of the impetus and the funding for this has come from government and in terms of the Rough Sleepers Initiative, and we look forward to discovering how that might be followed through. Committee last year took the step of deciding that they would continue to run with the COVID response service, even though we'd only got funding from government up until March. As I've explained, that's now essentially effectively been extended for us. That's very welcome. But that we, committee, I think, took that step in part because we didn't want some of these arrangements to fall over, whether they related to COVID and looking after the COVID needs of someone who's homeless, or some of our other health and well-being needs. We need to continue to attend to those in the years ahead. Thank you.
Thank you, Jonathan. Councillor Bowel.
Yeah, thank you. Very quickly, just to say I completely concur with all three of you that have spoken, all the comments you've made, completely in full agreement with and support. I just wanted to say that I've got my vaccine COVID card out here to prove I had my first 2 vaccines, but I'm one of the terrible people that's failed to have the booster, and not through any fault of my own, because I got the dreaded disease just before Christmas and had to cancel my booked-in appointment. But I just wanted to report to the committee that I'm actually being hunted down by the NHS from various different quarters, almost to an ridiculous degree. I've received countless texts on my phone to remind me that I must go and to very politely inform me how easy it is and where I can go to do it. I've also had phone calls from my GP surgery, as well as emails, and I'm now even having phone calls. So I think if you can fail to get away from all of this hunting down, then good on you, doing well, but not to in any way undermine the argument and the points you've raised about marginalised groups and those that don't have a mobile phone, and how we reach out to them. So it's great. I think that there is unanimity in this chamber around these issues. Thank you.
Thank you, Councillor Barney, for those comments. One last speaker issued, Councillor Welsh.
Yeah, just to say a bit about young people with regards to what Councillor David Martin said, and I think Jonathan said it quite eloquently as well, is that young people have played an actually significant role in ensuring that COVID actually lessons as such as well. I know there's a lot of young people, the majority of them have obeyed by the rules, so I don't think it is don't necessarily agree with everything that you've said, Councillor Martin, with regards to that. I just wanted to bring your attention to page 48, where it says development of the Food Community Fund, and also where it says about additional support is being given to domestic abuse helpline. Again, it's in line with what my colleague Councillor Paul Henshaw was saying, is that there has been some great work done during the pandemic on both of these areas, and it was really how that is panned out in the future, and that we use the very best of what we've done and continue with that work if we can, because as Councillor Doddy said in his initial motion at full council, the food and nutrition situation is worsening, it's not getting better, and if we could link up that Food Community Fund with the work that is essentially going to be done as a council as a whole, that would be really useful. And then last but not least, I work with a group in Gedling with regard to do I have breathing difficulties, and one of the things that they're really concerned about at the moment is how they move back into the normal world, because they're clinically extremely vulnerable, and sometimes there is a lack of guidance with regards to what they should or shouldn't be doing. I think they're used to the government saying, right, you should do this and you shouldn't do that, and suddenly it's like, well, you can go out if you want, but you might not want to. So it's just bearing in mind really with regards to this outbreak, and what happens next is where clinically extremely vulnerable people fit into that, and what the guidance is for them, and how we support them in Nottinghamshire as well.
Thank you, Councillor. I think the group clinically extremely vulnerable includes quite a wide range of people whose circumstances and clinical condition is actually quite different. So I think that we will struggle as a nation to come out with any one-size-fits-all guidance to all of them. And I think that rather it will end up being discussions which in due course they may wish to pick up with their clinicians, perhaps, as and when they're able to, and indeed with others in support groups and advocacy groups that they're involved with, other than some general guidance about how they can continue to protect themselves, which essentially is the same guidance as all of us need to keep in mind, because it is likely in the months ahead to be through some combination of measures, and not exclusively from vaccines, that we learn to live safely with COVID as a country. Thank you.
Thank you. Just like to echo what other councillors have said and put on record our thanks to the department for their hard work. Okay, we will now move to the vote on the recommendations set out in the report. All those in favour? Thank you, that's unanimous. We'll move to agenda item 7. Okay, it's the additional capacity to support more people home from hospital. The report follows on from a report at December committee to increase the department's reablement and social work capacity to enable more people who need support to be discharged directly home from hospital. Good joint working with partners across Nottinghamshire health and social care system has been progressed to develop a plan on delivering and funding the additional care and support capacity that is required to meet the anticipated increase in demand to support hospital discharge next year and to support elective surgery recovery plans. The clinical commission group aim to make a final decision on funding by the end of this month. Subject to agreement on the funding source, the committee is asked to approve the establishment of the required reablement and social worker and community care officer posts on a permanent basis, and to extend the project manager post supporting this work for a further 12 months. I move the recommendations set out on page 4 of the report.
And I second and reserve the right to speak, Chair.
Thank you very much, Councillor Barney. I'll hand over to Sue Batty, the Service Director for the Ageing Well Services. Thank you, Sue.
Thank you, Chair. So since writing the report, it's positive that we have got an update on the clinical commissioning group's position with funding, which is that they've agreed to partially fund it at this point, whilst we do some further work on the whole business case, which will need to go to their committee on the 9th of December. So the element that they've agreed to prioritise is temporary posts that we have in our reablement and social work services, and also temporary posts in our independent sector provider services that we boosted those services over winter. So the aim is not to lose those staff, but to make them permanent from April so that we can keep that capacity. So we are awaiting further details from the clinical commission group on that in writing, and we're working closely with them on some of the questions and the details of the wider business case. And that wider business case is how we resource permanently the capacity that we need in the community going forward. Thank you.
Thank you, Sue. It's a great report. I'm going to open it up to members now for comments and questions. Start with Councillor Martin.
Yeah, thank you, Chair. I think this is a very important report, and you can clearly see from the level of people that we're trying to sustain employment for how important it is, and the adverse impacts of not continuing that are set out in paragraph 7, that people will be delayed in hospital longer in times of pressure. They may not be able to come into hospital, and that more people could return directly to home. This is a real all-round omnibus for people coming in and going out of hospital, and it's essential. It saves money in every direction as well, because obviously people are going directly home instead of going into care homes and short-term care, which is costly. It also, how many councillors here have been to hospital and heard somebody say, "Oh, I'm waiting for them to release me"? This expedites the process all round. We used to be in not so long ago, we used to be in a time where if you were still in there after 5:30 on a Friday, you weren't going out till Monday. And it's all about cost. And I think we can't support this enough, because this really helps people's actual lives when they suddenly find themselves in hospital through no fault of their own, through accidents or whatever, or heart attacks or whatever. And it really helps people all round. And it was a very well thought out plan, and it came into the playing a few years ago, and you just built on it. And I commend the officers for doing it, because it actually in real life helps our residents every day. Thank you, Chair.
Thank you, Councillor Martin. Councillor Henshaw.
There's no more important truism, I think, that people, when they're in hospital, want to get home as quickly as possible, and not just because they're freeing NHS resources, but because most people like to get home so that they can recover in their own environment and surroundings, which is all the better. My worry has been indicated that it's now been partially funded in relation to the positions that we would agree to today. And in saying that, we know that there is a problem in recruitment in relation to care workers, support workers' jobs. If we pass this, or hopefully we will pass it today, how are we going to address that initial problem in relation to recruitment and retention of support staff? Because until we address that problem, we might be just kicking a can further down the road. I'm very interested in what the officer will have to say in relation to putting our business case to the people that hold the purse strings, and hopefully that partial funding will become proper funding. But let's see. But generally we support this, but we've got to be mindful that even though we may agree to the additional posts, we've got to do something about recruitment and retention. Thank you.
Thank you. There is a question in there. See, do you want to pick that up? Thank you.
Yes, thank you. So I think it's really positive that we've got a decision on partial funding, because it means that those people will stay in their jobs that we've got temporarily. I think when we do collaborative working across partners, their decision-making committees, aren't the same dates as ours. So we're working hard with our colleagues on the final detail of the proposal. It's real credit to our reablement service that they don't have the same problem as some other services. So they have very few vacancies at the moment and turnover. They do retain their staff, and just last week I got an email from somebody who started there and said how brilliantly they felt supported and how good it was to see every day they were making a difference to people. So, and in addition to that, I think Cash set out at a previous committee all the work that we are doing on our recruitment strategy across the wider social care system.
Thank you, Sue. I've got no other members signalled to speak. I will go back to Councillor Barney, who seconded and reserved his right to speak. Do you have any? No. Okay. We'll now move to the vote. All those in favour? That's unanimous. Agenda item 8 is the establishment of a personal assistant support service. Delivering the personal assistant market is a key strategic aim, as people tell us that they want more choice and control over their care and support. The department has in place plans to build capacity to support people, and PA support is a key part of this. Given the gap we have between requests for support and the support currently available, we need to accelerate work to build the PA market. The report details a proposal to establish additional posts in the central direct payments team to improve and increase the promotion and commissioning of direct payments to employ PAs. This will be trialled for 12 months and reviewed prior to any permanent changes being considered. I move the recommendations on page 5 of the report. Do I have a seconder?
I'll second those, Chairman, and reserve the right to speak.
Okay, thank you. Yeah. Councillor Carey, do you want to ask a question before I hand it over to Cash? Okay. Cash. Hello, Gemma.
Thank you, Chair. Just to add some additional points in relation to this paper. Really, this actually proposal was developed at the time when we were really thinking really hard around how can we further support some of the challenges that we've got within the home care market. How can we increase the capacity that is really required to support hospital discharge, but also to support people with long-term care needs. And so this proposal actually is quite ambitious in its nature, that it's aiming to go further and faster in terms of recruiting more personal assistants on a monthly basis, or way above our normal target. And the proposal is to establish this support service, which will be dedicated in coordination in the administration of recruiting personal assistants and the process to make it more streamlined. But crucially, it's around it's really very much around supporting and engaging with personal assistants and how can we shape that market going further. So I think in terms of this proposal, there are mutual benefits. The benefits, again, the paper highlights clearly there are high satisfaction levels and better outcomes achieved through choice and control through personal assistance. Equally, there are benefits in terms of increasing capacity within home care, which is one of our greatest challenges that we are facing at the moment. And thirdly, there are benefits, potential further benefits around net savings for the council as well. So overall, those are the ambitions that have been set out. We recognise that it's ambitious, so as part of our mitigation, we have proposing that these posts are 12 months. So if we can achieve those targets, it just means that there's no financial pressure on the department. Happy to take any further questions.
Thank you, Cash. I'll never criticise anyone for being ambitious and aspirational. I'm going to open it up now for members to comment and ask questions. I've got Councillor Fielding first, and then Paul. Yep, I've got you as well.
Well, there you go. Thank you. I welcome this, as I say, and hope that we can recruit to these posts.
Thank you, Civil. Councillor Henshaw.
Thanks, Chair. Yeah, I agree. Personal assistants are useful in many situations in relation to care and support packages, but they're not suitable for everybody. And it's vitally important that the person that's actually wanting the support is actively involved in the choice of person, because obviously they've got to work very closely together. So, and I think that's vitally important, that you have input from the person who is going to receive this support. So if that's part of the training, part of the process, then that's all well and good. My only concerns is that the positions are temporary. How do you see that affecting recruitment, Cash? Thanks, Chair.
Thank you. I'll hand over to Cash. Yep.
Thank you, Chair. So I think in terms of personal assistance isn't for everyone, recognise that, but there are different arrangements. Some people are happy to take on that responsibility of being an employer, and some people would rather want the council to do some of that administration. So there are flexibility. The key here is about co-production and really co-producing with the person that's requiring care and support needs. In terms of the recruitment, these posts are more administration and more technical roles, and we've had recent successes in recruiting for these types of roles. So we are relatively confident that we can use our existing arrangements to recruit to these posts.
Thank you. Thank you. Thank you. Thank you. Councillor Martin.
Yeah, thank you. I think it is ambitious, Cash, and I think it's a good thing to do, because I think some of the most difficult cases are where people will receive direct payments as a married couple and then they end up being split up for whatever reason through ill health, progression or ill health, and that's quite complicated then, because the direct payments have to be divided, and that having that independent person there helps them, provided the social workers get the hours right. That's the biggest issue I've found in my where the hours are allocated to one person as a couple, they're allocated jointly. Then when they separate them, that's where it can be a bit complicated. So yeah, I think I've seen them working before, and I think it's a very good service. Thank you, Chair.
Thank you, Councillor Martin. Councillor Carr.
Yes, just quickly. I think one of the most important things when it comes to care is choice. And the more choices that people have got at this stage, the better. Quite interesting, my son, who was over from Canada this Christmas and New Year, who actually, Councillor Carey, you and I were born at a very different time to my son, but my son was £1 3 ounce when he was born, 13 weeks early. But things were very, very different. But I asked my son, and in fact I told him, don't you dare put me in a home, or else I'll come back and haunt you. And quite surprisingly, he wasn't very committal whether he would or not. So the more choice that there is available for people to do what's right for them in later life, the better, in my opinion.
Thank you, Councillor Carr. Rest assured, we'll find you a nice one. Got no other members seeming to speak. I agree wholeheartedly. Welcome this. And just look at the case studies there, and having conversations with outside of the chamber where we've reviewed those the choices that the people using those services do make, and it's all about those positive outcomes and enriching people's lives and just keeping them positive, really, and giving them the best life possible. Okay, I'll now move to the vote. All those in favour? It's unanimous again. We like this. Okay, agenda item 9. Agenda item 9, implementation of the additional supernumerary social worker, said it, An occupational therapist apprenticeship posts as progress into qualified roles. The council, as one of the biggest employers in Nottinghamshire, has committed to the government's apprenticeship reforms since their introduction in April 2017. This report seeks approval for an intake of additional supernumerary social worker and occupational therapist apprenticeship posts as a progression route into qualified roles. This will help the department in addressing the challenges that exist on a national basis with regard to workforce planning for social worker and occupational therapist roles. I move the recommendations as set out on page 5 of the report. That's for a seconder.
Yeah, I'm delighted to second this, Chairman, and I'm so excited that I'm going to speak about it very briefly, right off the cuff. This is a fantastic item to second. My son recently qualified on an Inspire apprenticeship programme put on by Nottinghamshire County Council, and my goodness, what a life-changing transition that's been from the 16-year-old who didn't know who he was or what he wanted to do to a confident young man who's full of zest for life, knows exactly what he wants to do, and even talks a bit like an adult on occasion. So didn't learn that from his father. So absolutely cannot speak in the highest terms. And for it to also be social workers and occupational therapists, so much the better. We all know the brilliant role that social workers and occupational therapists play as the link between the system and the community, and the difference they can make in how they administer that in real terms in real lives. And looking at the officers opposite, I'm also acutely aware that some of the officers started their working lives also in the realms of social work and occupational therapy, and I know that they'd echo that my positivity around these things. So absolutely fantastic, and let's move this on and hopefully get it to the vote quickly.
Thank you for that injection of energy. It's most welcome. Cash, do you want to speak? Or I think we've introduced it enough. I've got Councillor Welsh asking to speak. Do you want to go now, Michelle? Go? Yeah.
Yeah, just to say that I really welcome this report. I'm sorry that I'm not as enthusiastic on a Monday morning as Councillor Barney.
Why not?
Barney is. But yeah, I am actually very enthusiastic about it. I actually firmly believe in apprenticeships, high quality apprenticeships. That is that, you know, wherever an occupation is possible to have various pathways to it. I think that's really a real positive thing, because certain learning routes aren't always right for certain people, but actually if you give them another pathway, they're absolutely fabulous at the end result. So yeah, I think this is absolutely fantastic, and I would love to see more and more of it, to be honest. And maybe this is just one of the many ways this county council can tackle some of those issues that we have with regards to recruitment in social workers. So very supportive with regards to that. Just a question with regards to, is there going to be a minimum requirement for people for accessing this apprenticeships? The reason I'm asking, obviously, is there an age, or is there a certain qualifications, GCSEs, A levels, and what that criteria is? It doesn't have to be answered now, but I'm just very much interested in how this would pan out in the future. But yeah, it's brilliant. So yeah, congratulations everyone that's been involved, and I apologise for not being as enthusiastic as Councillor Barney, but I will work on it.
That's fine. That's fine, Michelle. It's good to have you on board and have your support. Cash, do you want to pick that question up in there about the parameters for getting onto the apprenticeship?
What I can do is, I don't have the details at hand, but I can share the details around entry requirements.
But Councillor Martin, who is going to be equally enthusiastic.
You never know, do you? Yeah, no, I welcome this, and I have long banged the drum about education and following the route into these kind of courses, and I do think we need to take it back a notch and go to secondary schools, and when they're looking at sixth form colleges, because that's the entry level. That's where some people may start to pick up on this career path. We all know across adult health and social care for a long time we've been struggling to recruit staff into the roles, and we've got numerous roles that we can't fill because we just can't get the people to do it. And I noticed earlier this year we launched an advertising campaign by the county council. We need you to care, and I'm not so sure as that might be a tad negative on the staff that we've already got, because they do care, you know, and I think that might be a tad negative. I might be the only one that thinks like that, but it just sounds a little bit resonance of negativity there. But yeah, I'm all in agreement with this, and the more information we can get out to sixth form college entrance level and university students it can only be welcomed, because we clearly are in a place where we are finding it difficult to recruit and to retain staff. Thank you, Chair.
Thank you. I'll just go back to Michelle, your question. On page 1 of the report, paragraph 5, apprentices are now open to anybody over the age of 16 and are available for entry level. You can read that bit, but obviously the apprentice will be an unqualified member of staff, but it does help in their career progression. Okay. Councillor Henshaw.
How can we not be supportive of this proactive way of getting additional social workers and occupational therapists? I mean, it's got to be a good thing. I mean, very often people come into a job at I would say a lower level, and then after being there for some considerable time, they say, "Oh well, I could possibly move on for my own satisfaction and job satisfaction," but because of various circumstances, they're not able to go into a full degree course or into a full training course for an OT. So by having this sort of system where people can, you know, offer themselves and then grow into a job, I think that's fantastic, and it's much different to the apprenticeship that I signed on for in 1972 at Clipston Colliery, when I was sat there across the table from my dad, and the manager ripped the contract in half and gave me half and said, "Go away now, Paul. You're okay." I mean, that's the past. These are the future. These are the the innovations that we've got to do to increase people's awareness of not only doing these sort of jobs, but sort of, if they do it, then they can improve people's lives. And it's a brilliant suggestion, and I fully support it.
Thank you, Councillor John. And it's good to hear that things have changed in 50 years. I've got no other members indicating to speak, so we'll now move to the vote. All those in favour? That's unanimous. Thank you. Okay, agenda item 10 is the market management position statement. The report sets out to inform committee about the work undertaken by the quality and market management team in response to the local authorities' statutory duty to ensure that there is a robust and sustainable social care market available for people who live in the county. The team has stepped up their emergency support in response to the current impact of COVID-19, and there is an update on the current position of the social care market and what the team is doing to support this. The report gives an overview of the financial support that is being passported directly to the social care providers, and there is also an update on the progress since the last report on the social care workforce recruitment and retention project. In particular, the advertising campaign that will be commencing in mid-January 2022. The report also contains the current position in respect of social care providers that have had their contracts with the council suspended. I move the recommendations as set out on page 9 and 10 of the report and ask for a seconder.
I'll second that, Chairman, and reserve the right to speak.
Okay, and I just remind members that when we do start discussing this, there is also an exempt item after the work programme, so we'll keep to this part of the. Okay, I'll hand over to Cash. Thank you. Are you picking that up, or is it?
Yes, I'm going to invite Gemma to talk us through the report. Thank you.
Thanks, Cash, and good afternoon, everybody. Obviously, I thank you for the introduction, Councillor Elliott. In terms of the financial support for our providers, obviously the report sets out what grants have been passported over to providers, and I've given a bit of an example from one of our home care providers how positive what impact it has had on their organisation since they've had that grant, and obviously those grants are in place till the end of March. We will be doing some further work in terms of looking at what impacts that's had on the whole market through questionnaires, etc., because providers have chosen to use their grants differently. So we'll hopefully be able to report on that at a later date in terms of further impacts the workforce grant and also the infection control grant have had to support our social care providers. There's an update in terms of the COVID vaccinations mandatory for all social care staff. Obviously, the report sets out, and we've previously reported about the care home staff that have already gone through that process. Obviously, we're coming up to the 3rd of February date for the rest of the social care staff, so we are currently looking at the figures and the impacts, possible impacts that will have on our obviously internal, but our external market. We've talked about recruiting and retention quite a lot this morning, but and also members have mentioned the campaign, so that's part of the element of our workforce group that we're working on, and we've already seen some positive impact, small but positive impact from the campaign in terms of numbers of people that have gone onto our website to look for roles. And just to say this campaign, and I think it's We Need You to Care campaign that Councillor Martin referenced, that is for our external providers. There's obviously been campaigns that we've done for our internal recruitment, but this is around the external market, so it does link to all our external providers. And our providers are really happy and they are getting some positive responses from that. So fingers crossed, even if we get a slight increase on recruitment, that'll be really good. And just to say, we've referenced 4 videos we've done, and that's we've gone out to services to do those videos. So obviously the staff are wearing masks because obviously that's part of their role now is to wear the PPE. We're going to build on those videos and try and get some more once obviously we've got the impact of COVID and the outbreak to reduce. So there's a lot of updates in terms of our workforce group and the priorities we've got. So that's a lot of there's still a lot of work to do in terms of, for example, improving retention of nurses in nursing homes. We're working closely with our CCG and health colleagues to see what we can do in terms of supporting and getting more nurses to work in our nursing homes in Nottinghamshire. And I think that's it, unless there's any questions.
Thank you, Gemma. I'm going to open up now to members for comments and questions. I've got Councillor Carr indicated to speak.
Yes, just to point out, Chair, quite amusingly, it's a good job there's nothing controversial coming up on the agenda because the opposition parties have now got a majority in the room. But that's one thing or not.
I hadn't noticed. It's unanimous anyway. Everything's unanimous this morning.
That's why I said it's a good job there's nothing controversial coming up. It does worry me because a lot of the people that work in care homes are notoriously poorly paid, and we also lost a lot of people who during the pandemic, and not just because of the pandemic, went back to their homes in Eastern Europe mainly and have never returned. But it's also worrying because of these pressures on employment that it's been seen in Ashfield in the north of Broxton over the border into Amber Valley that the recent arrival of Amazon at Eastwood has actually, we as Broxton Borough Council have actually seen a reduction in people in our leisure sector who have gone to work for them because they pay a lot more, certainly pay a lot more than the care sector do, and it's a worry. The recruitment is a worry. Plus, and this is something I agree with, I agree that people who work in nursing homes and care homes are fully vaccinated. By the 31st of March, they have to be. If they're not, then they can no longer work in a nursing home unless they have an exemption, medical exemption. I just worry about how we're going to turn this trend of being able to attract people to work in the care sector when the levels of pay are so poor compared to other organisations around them.
Thank you, Councillor Carr. That's something that we do share genuine concerns. Before I go for an answer, Councillor Martin.
Yeah, thank you, Chair. I mean, I concur with what Councillor Carr says. It's a very difficult time, and as the last item that we talked about employing staff across this industry, and you can see at the top of page 117 the volume numbers involved. 155 care homes, 136 care homes providers. It's a much bigger task than people anticipate, and companies like Amazon on Summit Park, in between, just on the border of Ashfield, are really drawing staff away. So it's a very difficult time especially for private care providers, to recruit, and it is a difficult job. I mean, I've got 2 nursing homes in the very next village to where I am, and I know a lot of the people who work there, and the 2 homes are so different. It's unbelievable, but the level of pay is not. And that's the real problem that this industry faces. That's my take on it. So that's why we can see in the exempt report some of these care homes slipping into that, because they just haven't got the capacity to manage what they're actually doing, and it's a very finely balanced thing. And COVID has just exacerbated that situation. Thank you, Chair.
Councillor Henshaw, is your question in a similar vein?
You wouldn't expect it to be anything else, would you, Chair?
Exactly.
In relation to the report. I mean,
okay, I'll take your question, and I'm going to hand over to.
Well, my question is: are we going to do anything about the problem in relation to low pay and poor conditions? I mean, end of the day, we all know there's a crisis. We all know there's a problem. Yet we seem to be tinkering around the edges with relation to what we're going to do about it. Now, at the end of the day, if you're in a position where your cost of living and everything else is going up, and you've got to worry about turning your heating on, you're going to go for a job where you've got more remuneration. I mean, it's logical. If you don't pay people more, they won't do the job. Now, it's all right saying care work's a vocation. That's all right, but vocations don't put bread on the table, and this is the problem. I mean, I only looked last night at some job finder in relation to cleaners, starting at £10 an hour up to £15 an hour. People that stack shelves, £10.50 an hour up to £14 an hour. And I'm not saying those jobs aren't important, because they are, because society won't function without them. But what we've got to make sure, we've got to try and look at what we're doing in relation to pay and conditions of care staff. I can drive from my home in Mansfield to Sutton, and every care home that you drive by, there's a big sign outside saying, "Come and join our team." And people aren't doing it for whatever reason. And I think money is one of the big determinant factors on why people aren't entering care. It's just a fact of life. And if we don't address that problem, I think this crisis will go on and on and on. And we're talking about the same problem in another 5 years' time. Thanks, Chair.
Thank you, Councillor Henshaw. I'm going to hand over to Melanie, Corporate Director.
Yeah, so I think, councillor colleagues, you're correct that workforce is our biggest single risk that we have as a department, and possibly actually as a council, because it isn't just relating to care workers in social care. It also relates to drivers, domestic staff, and a whole range of other occupational staff that we rely on to continue services. There is a link to workforce and some of the topics that Gemma will talk about in the exempt item of the meeting, but there isn't the only risk that COVID has generated for the sector. So quality is a real concern, particularly the conditions that care staff have been working in, particularly in care homes, with the additional requirements for infection prevention control have been quite tiring for people. Pay is an issue, but it isn't the only issue. So in social care, we kind of describe that within care workers, so I think we've got higher ratio in council services, but it's about a 50-50 workforce. So half the people do it for the same reason that I did. I started as a care worker, it's what we do. Other half of people are more sensitive to pay. So even if we put up pay as a county, that would quickly get eroded by competition increasing pay, but also we know it's not the only deciding factor for staff. So there are some issues I think as a county council we can resolve, and Gemma and Cash have highlighted some of that in the paper in terms of incentivising. We do have favourable terms and conditions in our contracts compared to other authorities, particularly around the way that we compensate for travel and other aspects, and the PAs actually is another mechanism about trying to improve that terms and conditions. So we can work on those things, but certainly some of those other factors I think need to be tackled regionally and nationally because they're part of the sector, particularly around improving care worker
I suppose the kudos, you know, the rate, the fact that this is work that's, I think, a cut above other careers, I think is something that has to be solved nationally, that we can't tackle as a county alone, would be my view.
Thank you, Melanie. It's not just a county-wide issue; it's a worldwide issue now. So, but pay is not the only issue. So, thank you. I've got no one else indicated to speak. We'll now move to the vote on the recommendations as set out in the report. All those in favour? Thank you. That's unanimous for the people that are here. Okay, we'll now move to agenda item 11, which is the work programme. The recommendation of the report, as set out on page 122 of the agenda pack, is that the committee considers whether any amendments are required to work programme. I formally move the recommendation.
And I'm pleased to second.
Thank
Chairman.
you. That's great. Any comments? No. Oh,
Apologies, I mentioned earlier about having some more data about the health inequalities that existed within Nottinghamshire in relation to some of that data that we have. I'd wondered if you'd perhaps go away and consider having that as a report that comes to council at some point. You know, when you're talking about birth rates and all the other things, it would be useful to know what's going on in Gedling as well as what's going on in Mansfield and how that differs.
Okay.
And it might feed into the motion that Councillor Doddy, etc., put forward.
It's gone.
Yeah, it isn't
Did
there
he?
anymore.
Yep.
You know.
Okay.
But yeah, just I don't know if those figures exist, but it would be useful to see what is actually happening within Nottinghamshire, as well as having that comparison to what is happening in the country. So that may be not what you can answer now, but I just wanted to say I'd be useful.
I know when Jonathan answered your question, he's going to try and find that information, but we'll see where it fits in. And we'll get it there for you, Councillor Carr.
Yeah, I noticed on the 25th of April we've got the Oral Health Promotion Service procurement on there. I wonder at some stage if we should have a report come to us about the situation with dentistry, because I understand that NHS dentistry is on a knife edge, and I'm concerned that it is quite expensive, private dentistry, and again, if we're going to have a situation where there's no NHS dentistry, how are people going to cope with the cost of that? The answer is, of course, they just won't have it done. But it would be good to see a report on the risks on that.
Okay, I've just been informed, Steve, that it's the dent is not. That's not within our remit. It's with the NHS. So we could ask for it to go to scrutiny. Yep. Okay. Thank you. With all that, can we move to the vote? All those in favour? Thank you. That's carried. I didn't see your hand. No.
Sorry.
Okay.
Just as regards health checks, because it's been on the agenda for for 5 years at least, and it's been a fluctuating, unsuccessful trend. And I'm just wondering whether we are doing it in the right manner. Is this a national thing, or can we change it in our county the way we manage the health checks that are done?
Jonathan, sorry.
I'm not sure whether you want to have a shot answering the question or whether it's about the work programme. Is it
on the work programme? Because health checks are obviously managed by doctors' surgeries, right? And it's a bit like taking your car for an MOT. It creates work. And when they're under the cosh and during COVID, they've been under stress even more. Is there any way we can change the system so that it's done in another way?
It's national policy.
National policy.
Yeah.
So we can't change it here.
So it'd be a no.
Right.
Okay. Let's move to agenda item 12. Was the exempt item. So I have to read the bit with the exclusion of the public now. We're going to. Okay. We now move to the part of the agenda that proposes we meet in closed session to consider the exempt information in relation to agenda item 14. I therefore invite the committee to resolve that the public be excluded for the remainder of the meeting on the grounds that the discussions are likely to involve the disclosure of exempt information as described in Schedule 12A of the Local Government Act 1972, and the public interest in maintaining the exemption outweighs the public interest in disclosing the information. Do I have a seconder?
I'll second that, Chairman.
Okay, show of hands. Thank you. That's carried.